ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੀ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਬੋਨੀ ਹੈਨਰੀ ਨੇ BC ਅੰਦਰ ਕੋਵਿਡ-19 ਆਊਟਬ੍ਰੇਕਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਅੱਜ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ 530 ਐਡੀਸ਼ਨਲ ਕੋਵਿਡ-19 ਦੇ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਹਨ। ਇਸ ਦੇ ਨਾਲ ਹੀ BC ਅੰਦਰ ਕੁੱਲ ਐਕਟਿਵ ਮਰੀਜ਼ਾਂ ਦੀ ਗਿਣਤੀ 82,473 ਹੋ ਗਈ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਐਕਟਿਵ ਮਰੀਜ਼ਾਂ ਦੀ ਗਿਣਤੀ 4,743 ਹੈ।
To start with today, we have an additional 564 new cases of COVID-19 reported in the province, including 12 epidemiologically linked cases, bringing the total number of people in British Columbia with COVID-19 to 82,473. Of those, 168 are in the people in the Vancouver Coastal Health Region, 279 people are in the Fraser Health Region, 35 people are on Vancouver Island Health, 36 people live in the Interior Health Region, and 46 people live in the Northern Health Region. We now have 4,743 active cases across British Columbia, of whom 248 are in hospital, 63 in critical care or ICU. And we have 8,659 under active public health monitoring. And on the positive side, 76,289 people are now recovered. We've had 4 additional deaths in the last day from COVID-19, bringing our total to 1,376 people in our province who have succumbed to the virus. And our condolences go out to our families, care providers, and our communities who have lost loved ones during this most difficult time. We have no new outbreaks to report today, and we have 7 outbreaks in long-term care and assisted living, 3 now in independent living, with very small numbers, thankfully, on those, and 8 outbreaks in acute care settings. We have those involve the long-term care and assisted living involve 269 residents and 131 staff. As you know, we are following quite closely the variants of concern that are rising in the province and across Canada, and we've had an increase today of 46 new confirmed COVID-19 cases that are variants of concern. So that brings the total to 246 that we know about in the province. Of these, 16 cases are still active, and the remaining are people who have had past cases. 218 are the B117, which is associated initially with the UK.
ਓਟਾਰੋ ਦੀ ਸਿਹਤ ਮੰਤਰੀ ਕ੍ਰਿਸਟਨ ਐਲੀਅਟ ਨੇ ਮਾਨਸਿਕ ਸਿਹਤ ਅਤੇ ਨਸ਼ਾ ਮੁਕਤ ਸੇਵਾਵਾਂ ਦੇ ਵਿਸਥਾਰ ਅਤੇ ਵਾਧੇ ਲਈ $12.8 ਮਿਲੀਅਨ ਦਾ ਨਿਵੇਸ਼ ਕਰਨ ਦਾ ਐਲਾਨ ਕੀਤਾ ਹੈ। ਇਹ ਫੰਡਿੰਗ ਪ੍ਰੋਵਿੰਸ ਸਰਕਾਰ ਮਾਨਸਿਕ ਸਿਹਤ ਸੰਬੰਧੀ ਚੁਣੌਤੀਆਂ ਨਾਲ ਨਜਿੱਠਣ ਲਈ ਅਤੇ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਦੌਰਾਨ ਨਸ਼ਾ ਮੁਕਤੀ ਦੀ ਸਹਾਇਤਾ ਦੇਣ ਲਈ $176 ਮਿਲੀਅਨ ਦਾ ਹਿੱਸਾ ਹੈ।
And hello everyone. I'm Christine Elliott, Ontario's Deputy Premier and Minister of Health. Our government has made a commitment to build a comprehensive, connected and integrated mental health and addiction system that works for everyone in Ontario. Today's funding announcement continues to deliver on that commitment. Now, more than ever, it's critically important to ensure that people across Ontario can access the safe and effective mental health and addiction services they deserve, when and where they need them. That includes Indigenous communities. The funding we're announcing today is part of an additional $176 million we have provided this year as part of Roadmap to Wellness, our comprehensive plan to deliver high-quality care and build a modern, connected, and comprehensive mental health and addiction system. Roadmap to Wellness is a plan built from the ground up through meaningful consultation with stakeholders across the province, including, of course, Indigenous leaders, communities, and people with expertise in Indigenous mental health and addictions, grassroots community organizations, frontline healthcare providers, health system leaders, experts and advocates, and of course, people with lived experience of mental health and addictions issues, their families and caregivers. Roadmap to Wellness was created to address the long-standing concerns that we heard. Wait times were too long, people did not know where to get help, and they found it hard to understand and navigate the system. Today's announcement demonstrates our commitment to working with Indigenous communities and other health system partners to address these long-standing challenges. This funding will enhance and expand existing services, improve quality of care by merging traditional Indigenous knowledge with healthcare best practices, and improve access to care for those who need it. We will continue to work collaboratively with Indigenous partners and communities to co-develop programs and services that will enable Indigenous peoples to access high-quality, culturally appropriate mental health and addiction services across the continuum of care.
ਕੈਨੇਡਾ ਦੀ ਇਨਫਰਾਸਟ੍ਰਕਚਰ ਅਤੇ ਕਮਿਊਨਿਸਟ ਮਿਨਿਸਟਰ ਕੈਥਰੀਨ ਮੈਕਕੇਨਾ ਨੇ ਜ਼ੀਰੋ ਨਿਕਾਸੀ ਬੱਸਾਂ, ਸਕੂਲ ਬੱਸਾਂ ਅਤੇ ਚਾਰਜਿੰਗ ਸਟੇਸ਼ਨਾਂ ਦੀ ਖਰੀਦ ਲਈ $2.75 ਬਿਲੀਅਨ ਦੇ ਫੰਡਾਂ ਦਾ ਐਲਾਨ ਕੀਤਾ ਹੈ। ਜ਼ਿਕਰਯੋਗ ਹੈ ਕਿ ਇਹ ਐਲਾਨ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਵੱਲੋਂ ਫਰਵਰੀ 'ਚ 8 ਸਾਲਾਂ ਲਈ ਜਨਤਕ ਆਵਾਜਾਈ ਪ੍ਰੋਜੈਕਟਾਂ $14.9 ਬਿਲੀਅਨ ਦੇ ਐਲਾਨ ਤੋਂ ਬਾਅਦ ਸਾਹਮਣੇ ਆਇਆ ਹੈ।
I want to start by recognizing we're on the traditional territory of the Algonquin and Anishinaabe peoples. Unfortunately, we're in the riding of David McGuinty. Unfortunately, he could not join us today. He's a member of Parliament for Ottawa South. I'm certainly delighted to be joined virtually and in person by a number of people, including my good friend, Minister Champagne, who is the Minister of Innovation, Science and Industry, but also he has a lot of experience in this space because he was the former Minister of Infrastructure. I'm thrilled to be here with the Mayor, Mayor Jim Watson. He, I think, has an exciting announcement or support for today's announcement, but thank you for allowing us to be here at the bus hangar. Also, Councillor Jean Cloutier, he's the Vice Chair of the City of Ottawa Transit Commission. Also joining us virtually, we have Aaron Corey, the CEO of the Canada Infrastructure Bank, a real partner in this initiative and many others. And another friend, Josipa Petronik. She's the President and CEO of the Canadian Urban Transit Research and Innovation Consortium, QTRIC. So in Canada, we think big. That was true when we pushed the railway across the continent. That was true when we built the Trans-Canada Highway and when we built the St. Lawrence Seaway. While today we call this infrastructure, it's really about building what we need for the future we want. While we're reeling from a devastating pandemic and a stalled economy, moving forward is more important than ever. We need to build our way out of this pandemic, and we need to build back better. Il est donc temps de voir grand, tandis que nous investissons dans des transports en commun modernes et durables partout au pays afin de réduire la congestion, de créer 1 million de bons emplois et de soutenir l'établissement de collectivités propres et inclusives. Our government has been making historic investments in public transit projects. Since 2015,
ਓਨਟਾਰੀਓ ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਡੇਵਿਡ ਵਿਲੀਅਮ ਨੇ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਕੋਵਿਡ-19 ਦੀ ਸਥਿਤੀ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੰਦੇ ਦੱਸਿਆ ਕਿ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਸੋਮਵਾਰ ਨੂੰ 2191 ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਨੇ, ਮੰਗਲਵਾਰ ਨੂੰ 966 ਕੇਸ, ਕੱਲ 958 ਤੇ ਅੱਜ 994 ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਨੇ। ਇਹਨਾਂ 3 ਦਿਨਾਂ ਦੇ ਪੋਜ਼ਿਟਿਵ ਕੇਸਾਂ ਦਾ ਅੰਕੜਾ 1000 ਦੇ ਕਰੀਬ ਰਿਹਾ ਹੈ।
So, as on Thursday, we see how has the week gone, what are we looking for as the week goes ahead, and how are we doing overall. So, if we look at our data and information materials, we've added since Monday an additional 2,918 cases of COVID-19. That means we had 966 cases on Tuesday, 958 cases yesterday, and 994 cases today. 3 days under 1,000. And so we haven't seen that for a while. So in that matter, the new cases reported today, 298 are in Toronto, 171 in Peel region. Ontario's current 7-day average for COVID-19 cases is 1,063, which is slightly lower than the same period last week when the average was 1,099 cases. We're also reporting an additional 38 deaths since Monday. And these are issues that, of course, we're always concerned and extending condolences to the family members who lost their loved ones. 11 of those deaths were on Tuesday, 17 deaths reported yesterday and 10 deaths reported today. That means the 7-day average of daily deaths has now decreased to 15, down from 20 in the previous 7-day period. All these are, while being disturbing, are still encouraging directions. We'd like these down even lower. In terms of hospitalizations and ICU admissions, there are 649 COVID-19 patients in hospital. That's down from 687 last week. And we have 281 patients in the intensive care unit, a slight drop over last Thursday when there were 283 patients in ICU. So it has plateaued at this time. With respect to testing, while we have our usual dip of lower volume people going to assessment centers over the weekend,
ਅਲਬਰਟਾ ਦੇ ਸਿਹਤ ਮੰਤਰੀ ਟਾਇਲਰ ਸ਼ੈਡਰੋ ਨੇ ਕੈਲਗਰੀ 'ਚ ਇੱਕ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਨੂੰ ਸੰਬੋਧਨ ਕੀਤਾ ਹੈ। ਉਹਨਾਂ ਪੱਤਰਕਾਰਾਂ ਨੂੰ ਸੰਬੋਧਨ ਕਰਦਿਆਂ ਦੱਸਿਆ ਕਿ ਸਰਕਾਰ ਦੇ ਤਾਜ਼ਾ ਬਜਟ ਰਾਹੀਂ $143 ਮਿਲੀਅਨ ਦੇ ਨਿਵੇਸ਼ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਹੈ, ਜੋ ਕਿ 5 ਨਵੇਂ ਸਿਹਤ ਪ੍ਰੋਜੈਕਟਾਂ ਲਈ ਫੰਡ ਦੇਣ ਦੇ ਯੋਗ ਹੋਣਗੀਆਂ, ਜਿਸ ਵਿੱਚੋਂ ਫੁਲਟਿਜ਼ ਹਸਪਤਾਲ 'ਚ NICU ਬਣਾਉਣ ਲਈ $23 ਮਿਲੀਅਨ ਦਾ ਨਿਵੇਸ਼ ਕੀਤਾ ਜਾਵੇਗਾ।
And I'm delighted to be here with my colleagues, as Minister Copping said. We're joined by the Minister of Infrastructure, Prasad Panda, as well as Minister Copping, as I said, the was not only the MLA for Calgary Varsity, where the Foothills campus is, but also the Minister of Labour and Immigration. We also have some other special guests with us today, as Minister Copping said. We have Dr. Ted Braun, who is the Vice President and Medical Director of Clinical Operations at Alberta Health Services. Thank you to Dr. Braun for joining us. We also have Mike Meldrum, who is the CEO of the Calgary Health Foundation. And most important of all, we have Molly and Patrick Wilding and their daughter Gianna. And this day is about them. And it's an honor to have them here with us today. We're committed to maintaining a world-class, publicly funded healthcare system that's there for Gianna and all Albertans, and when they need it and where they need it. To deliver on that commitment, we need state-of-the-art facilities. Through Budget 21, we're investing $3.4 billion over 3 years in capital funding for health facilities, equipment, and information systems. And with this funding, work will continue on existing major projects, and that includes the Calgary Cancer Centre, the Jean Zwazdesky Centre at the Norwood in Edmonton, and the new Southwest Edmonton Hospital as well. And today, I'm very pleased to announce that we've also added $143 million in Budget 21 for 5 new projects. Here at the Foothills Medical Center, we're investing $23 million, plus a significant contribution from the Calgary Health Foundation to add 19 beds to the neonatal ICU unit. Now, the NICU here at Foothills serves Alberta's smallest, our most fragile patients. It's one of the busiest in the country, and in fact, you can see it from here. It's up on the fourth and fifth floor, is it? The fourth and fifth floor? Well, 5th and 6th floors. Now, once completed, the new beds will look out over this courtyard. And this is the only NICU in southern Alberta. The skilled staff and the skilled physicians care for the most fragile newborns.
ਤੇ ਉਧਰ ਟਾਇਲਰ ਸ਼ੈਡਰੋ ਨੇ ਅਲਬਰਟਾ ਅੰਦਰ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਦੇ ਦੂਜੇ ਪੜਾਅ ਲਈ ਰੋਲ ਆਊਟ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਦੂਜੇ ਪੜਾਅ ਲਈ ਬੁਕਿੰਗ ਦੀ ਸ਼ੁਰੂਆਤ ਹੋ ਚੁੱਕੀ ਹੈ। 15 ਮਾਰਚ ਤੋਂ ਸ਼ੁਰੂ ਹੋ ਰਹੇ ਅਲਬਰਟਨਸ ਨੂੰ 65 ਤੋਂ 75 ਸਾਲ ਦੇ ਉਮਰ ਵਰਗ 'ਚ ਟੀਕਾਕਰਨ ਪ੍ਰਕਿਰਿਆ ਦੀ ਸ਼ੁਰੂਆਤ ਕੀਤੀ ਜਾਵੇਗੀ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਟੀਕਾਕਰਨ ਦੇ ਇਸ ਪੜਾਅ ਤਹਿਤ 4,37,000 ਨਾਗਰਿਕਾਂ ਨੂੰ ਵੈਕਸੀਨ ਮੁਹੱਈਆ ਕਰਵਾਈ ਜਾਵੇਗੀ। ਸ਼ੈਡਰੋ ਨੇ ਕਿਹਾ ਕਿ ਪਿਛਲੇ ਮਹੀਨੇ ਟੀਕਾਕਰਨ ਦੇ ਪਹਿਲੇ ਪੜਾਅ ਦੀ ਸ਼ੁਰੂਆਤ ਕੀਤੀ ਗਈ ਹੈ।
Tom, and good afternoon, everyone. Today I'm here to announce another exciting step in Alberta's COVID-19 vaccine rollout. We've come a long way in a very short period of time. In less than 3 months, we've given out over 266,000 doses of vaccine. About 176,000 Albertans have now been vaccinated, including 90,000 who are now fully immunized with 2 doses. And there's no question, our vaccine distribution system is picking up speed. Yesterday, we provided about 11,000 shots, which is around the average level we'll be working at through March based on the current supply that we are getting from the federal government. And as I said before, we can roll out whatever supply we receive. The only constraint that we have as a province is the supply and the schedule of deliveries. With the vaccine supply finally stabilizing, we're getting doses into the arms of Albertans faster and in larger numbers. Thanks to the hard work of thousands of healthcare workers and the incredible uptake from eligible Albertans, we're now able to announce 2 more steps forward. First, I'm pleased to say that bookings for Phase 2A will begin the week of March 15th. Now, this means that more than 437,000 Albertans between the ages of 65 and 74 will soon be offered the vaccine. To avoid long delays and frustration for those making appointments, we'll be adjusting our approach. So when Phase 2A begins, bookings will start being offered in 2-year age groups. So on the first day, anyone who is between the ages of 73 and 74 will be able to book. And then on the second day, we'll expand eligibility to include anyone in between the ages of 71 and 72, and then so on from there. Staff and residents in senior supportive living facilities who are not already immunized will also be able to book appointments starting on day 1. Appointments will be booked through both participating pharmacies, the online booking tool, as well as HealthLink 811. First Nations, Inuit, and Métis people who are aged 50 and older will also receive the vaccine starting the week of March 15th.